So, today I'm gonna do a musculoskeletal assessment. Again, I don't have a patient, but I'm gonna kind of go through the steps and the reason why we do musculoskeletal assessment. So, of course, we wanna provide patient privacy. We perform hand hygiene, and we enter the room. We introduce ourselves, and then we always ask for we always tell the patient what we're here for and what we're going to be performing on them. So, okay, so first we want to we want to palpate the temple mandibular joint over here by asking the patient to move the jaw, stick out the chin, move it from left to right, and place it back normally. And we're looking for a clinking sound or any pain or tenderness that the patient could experience along the way while you're palpating. And we can also ask the patient to bring the chin to the chest while we're looking for a straight line and the spinal process on the neck all the way to C7. And we're also looking for symmetry of the shoulders. Also, yeah, we're looking for symmetry of the shoulders, and we're gonna inspect for range of motion of the shoulders. And while we're asking the patient to bring both arms to the top and back down. Bring both arms to the back. We're asking them while they're doing that if they feel any pain, if they feel uncomfortable doing it, any tenderness or anything like that. And we also want to palpate the shoulder area by the clavicles for any formation of mass, any skin breakdown or anything like that. And after that, we ask the patient to bring both arms forward. We'll palpating the hands for any tenderness. We want to make sure there's no malformations. There's anything abnormal. That's what we're looking for. If the patient feels comfortable with you palpating, if they feel any pain or tenderness, all of that, we want to ask them to move their joint, open their hands, bring the fingers together, put them apart and stuff like that, bend their hands. All of that is just to make sure that there's no pain. They feel comfortable doing all of that on their own. And after that, we want to check the patient's before that, we need to check the strength of the upper extremities. We can ask the patient to bring both arms forward like that, and then you're asking the patient to push forward against resistance and pull against resistance too, while you're like kind of holding the limbs and stuff like that, just to check for strength. After that, we can move down to the knees and we palpate both knees. We always gotta make sure that we do it for both side. We're looking for mass, asking the patient if they feel any tenderness and stuff like that. We're gonna do the same thing that we did for the upper extremities. We want to make sure that we ask them to move both legs forward, move them backward. against resistance. Also ask them to push forward against resistance and pull against resistance. Also we want to check the feet, just like we were doing for the hands, for any malformations, any mass, anything abnormal that we could find. And always ask the patient if they feel any tenderness, any pain while we're palpating any part of the body. And also we want to ask the patient to bend the knees, bring it like toward the body, and release it and move it normal. I mean, of course, we're making sure that there's no pain, no abnormality. And after that, we can ask the patient to take the shirt off so we can look at their backs. And while we're doing that, we want to make sure that we both the shoulders, from looking at them on the back, the shoulder, the clavicles are symmetrical, and there's a straight line in the middle of the back. For the spine, we can ask them also to bend, like kind of touching their feet or their toes. Then we're looking for the shape of the back. The upper back should look like a C, and the lower back should look concave inward. And this is the way that the back should look. If we're looking at it also from the side, we have to see that C part, that C for the upper back, and like a reverse C, I can say, like an inward curve for the lower back. And of course, as we're doing that, we want to look for skin integrity and stuff like that. And also this is important that we ask the patient if they have any history of joint issues, joint disease like arthritis or osteo and stuff like that. And I think beside that, I mean, we're pretty much done with the musculoskeletal assessment. It's basically assessing the joint function, range of motion of the muscles and joint of the body. Yeah, that's it. Thank you. I'll see you later.